Welcome everybody, thank you Donna, and to friends of Beer Zeit and Cafe Palestina. It's a really nice and intimate setting, I think, for a presentation like this. I hope that after the talk we'll have a lively conversation and questions. So I'm really honoured to be here, asked to chair an event with Dr Yasser Abu Jamei, which I've mispronounced on many, many occasions, Director General of the Gaza Community Mental Health Programme. My justification in a way for being here is my involvement with the UK-Palestine Mental Health Network. And I'd like to say a few words that will perhaps convey something of the network's role or approach, and also suggest something about the way that we listen to what we're presented with today, not simply as perhaps passive consumers, or but what are we actually supposed to sort of make of it, if you like. I went to the meeting last night in Birkbeck and heard Yasser, so as I'm quite a fan. On the way back home, and by complete coincidence, I found myself sharing the railway carriage with somebody I'd never met before, but who had also been at the meeting. He's a British Palestinian psychologist. During our conversation, she wondered aloud whether she would be able to share what she had heard with her colleagues, or whether she'd be too anxious to raise such a controversial issue with them. I think this speaks volumes about British culture and British society. We all know exactly why she would feel that way. Her fears are well-founded. And I said that I thought we all found it easier to speak up if we know that we're not alone. And the network, one of the functions of the network, I think, is to provide support to each of us in our attempts to raise the issue of Palestine in our professional and working environments. During her introduction to yesterday's talk, Jacqueline Rose told us that in her work, she uses psychoanalysis to understand the mindset that allows the conditions that prevail in Palestine to exist. And she stressed that these conditions, by any set of international standards, are completely unacceptable. I've learnt a great deal from Jacqueline and have a great respect for her work, and in a more mundane way I've tried to do something similar. But I'm sort of using that here to indicate perhaps something of another approach that we might take. Within a therapeutic relationship, an interpretation is in itself an active catalyst for change. Outside of a clinical relationship, I think the sort of deeper intellectual excavation on its own might be a kind of displacement activity in a way, trying to deal with our horror and guilt, perhaps, feelings that so many of us share and which perhaps need to be channeled into something more effective. So rather than use psychoanalysis to explain the inhumanity of the occupation, we want to ask mental health professionals and others, why are you so silent, and why are you indeed collusive in this ghastly situation? And this is not simply a rhetorical question. It's a sort of name and shame, if you like. In a few weeks' time, the Neuropsychoanalysis Association will hold a conference in Tel Aviv. When challenged about choosing this location for their work, the conference organisers issued a statement suggesting that their event in itself provided some sort of way of addressing the issues of occupation and human rights. They wrote that playing, negotiating and bridging differences, adopting an empathic attitude, stepping outside our respective comfort zones, interacting freely with others was a serious political contribution. I quote, "We urge you to come to Israel, attend the Congress, and interact with local professionals who are working together to increase understanding and tolerance in this troubled region." By local professionals, they clearly didn't mean Yasser's colleagues at the Gaza Community Mental Health Programme. They're excluded on account of their ethno-religious identity. At the conference, I suggest, a group of well-to-do professionals will travel to Palestine, where they will enjoy the privileges of apartheid, enjoying comforts that are denied to Palestinians in their own homeland. I think it's a disgrace. But the position of the Neuropsychoanalysis Association is quite typical, an expression perhaps of an arrogant determination not to engage meaningfully with Palestinian experience or perspectives, and certainly not with their views on foreigners who engage in a normalisation of colonialism and apartheid. So, we shall all, I know, listen very carefully to what Yasser has to share with us tonight, trying to grasp a sense of the bizarre reality that he is describing. And my point is that at the same time, he will be telling us something about what our own society has helped create and helps to maintain and protect. Our understanding, if you like, within the network is that if we want to contribute to changing the situation in Gaza, the most effective way to do this is actually quite close at hand in changing attitudes towards settler colonialism and apartheid here in the UK. So, I'm hoping that tonight might help strengthen our capacity and resolve to fight colonialism and racism, to help decolonise our society as part of the struggle to decolonise Palestine itself. Now I can get to my proper job, which is introducing Yasser. Yasser Abu Jamei is a psychiatrist who's been Director General of the Gaza Community Mental Health Programme since 2014. Educated in Palestine, the UK and Germany, he's received a number of prestigious awards in recognition of his work developing Gaza's mental health services. In 2020, together with colleagues from 48 Palestine, the West Bank and the diaspora, he co-founded the Palestine Global Mental Health Network. He presides over an organisation that has for years been exploring the interface between mental health and human rights. Over to you, Yasser.
Thank you very much, Donna and Martin. It's really such a privilege to be here among you people. It's already very warm, welcoming, and very warm setting, which is, there is always a place that is very warm for people to sit. And I think the organization of the event was something that is a blessing, if I could say. Birzeit University is one of the leading universities in Palestine, and I am really glad to be here with friends of Birzeit University, of course, as with the colleagues from the UK-Palestine Mental Health Network. When I meet people, whether in media or whether like over a journal, or like when I meet old friends of GCMHP, friends of the founder of GCMHP, Yad Sarraj, or my own friends, they all the time ask me, how are things, what's new, what happened, what are the developments, And they all the time refer to the days when GCMHP began. And all the time I find a very short 2.5 hours, 2.5 minutes video, very meaningful, just to explain how things were, to explain why GCMHP was founded from at the same place, to explain what was the vision of the founder and what is the mission of GCMHP, to explain how we continue that path until today. And this is a very nice video to begin a very hard, conversation. And we will have some moments of hope, of course, but we will have also some moments of despair. But let's begin with the hope first of all. So this organization, I'll just shift to the video clip that we can watch. Hopefully the technology will help us. If it doesn't, then I'll talk it over, but hopefully things are fine. Oh, the screen is nice. Okay, let's go. So this video was made by friends who surprised me. They did their homework, if I could say, and they sent me the link. Look, we have prepared something for you. It's a reflection of what we think of GCMHP. And that was in the end of 2014, the beginning of 2015. So even this video is now 8 years old. You do the calculations, okay? So yes, there were some problems in the 80s. We all know those problems, And the idea was, how can we help the children? I'll not repeat the same story that was told in a very short and precise and comprehensive way. GCMHP began with one community center in Gaza City. Then we had the second one in Khan Yunis in 1992, and the third one in Deir al-Balah in 1996. Through the three, we try to provide the main mental health services to people in Gaza Strip. But with time, it never came better, We had a very short, 6 years of, I would say sometimes use the word honeymoon, That was between 1994 and 2000. These were golden days where the Palestinians in Gaza and West Bank, of course, there was a big hope for a peace ending with a two-state solution with East Jerusalem, the capital. That was the deal, that was the agreement. That was what the Oslo Accord was about. Anyway, the second Intifada began, more problems from 2000. And in 2014, we had the first military large-scale operations in Gaza Strip. That ended with the killing of so many people, and you are more likely to be aware of what happened since 2007 until now, or since 2014 until now. But to make a long story short, for anyone who would think about Gaza today will think all the time of this is a place that is under long-term occupation since 1967. Yeah, we know the story. Okay, what else? It's under long-term blockade. It's already 15 years. We are in the 16th year since the beginning of the blockade. Was there in history a longer blockade? I am not sure, but we know what is a blockade. If you don't know, I recall a lot of my colleagues and friends when we were talking during COVID-19, they said we now understand what the movement restriction means. Okay, because a big part of the blockade was movement restrictions. Now things are a little bit better in Gaza. The borders with Rafah are open almost on daily basis, with the exception of Fridays and Saturdays. However, the number of people who leave is minimal. It's about 600 to 700 people per day. But there are all the time some security concerns with traveling through Sinai. Hopefully that will improve with time. With the Israelis, it's a totally different story to travel through Beit Hanun or through areas. So people, when they were under the COVID, they said, okay, now I understand. When you are not allowed first to leave your country, then to leave your city, then to leave your neighborhood, then you are allowed for only a specific period of time to go even to the supermarket. And that really brought some of the realities of Gaza Strip to the international community. So that was a long-term blockade, economic crisis. And the economic crisis, is so severe that can be translated simply in two words, which is poverty and unemployment. These are indicators generally we use when we talk about economy. So how is the poverty rate in Gaza Strip? Now it's about 50%, I think 53%. So 53% of the population live under poverty rate. And then what about unemployment? Unemployment rates for people is now about 46 to 47%. Young people the age of 30, it's 60%. Young women below the age of 30, it's more than even 70%. These are the most recent statistics. During COVID-19, the unemployment rate was even, I think, around 54%. So now it's a little bit better, around 46%. So you speak about half of the population under poverty rate, half of the working force are not really employed, are not doing anything that can help them go on with their lives. Economic crisis, if you speak about power supply, On the best days, it's 8 hours on and 8 hours off, alternating, you know. You see, there are 3 golden moments, you know, and they keep say this thing, which is like 6 a.m., 2 p.m., and 10 p.m. These moments are very important because it's when the power supply comes or is cut, you know. These are the 8 hours alternating. So if you wake up in the morning or you go to sleep at the night, you expect it's like alternating. So one night you sleep without power, one night you sleep with power, one night you wake up without power, one night you wake up with power. And what does that mean to a family, you know, when you have such poverty rate, when you have such unemployment rate, when you have such problem with power? And I recently started to give an example that it's part of our daily life, you know. We don't feel that it's an example, but really it's the case, it's example. We cannot by any means think that the abnormal things that people are enduring are normal, you know, by any means, okay? So this is the story, you know. If you speak about the life of any family, in average we have about 5 children per family, you know, okay? That's the average for Gaza, 5 per family. The schooling system is so crowded that they try to find means of getting more children into the class, maybe, but also getting more getting more use of the space. Yes, what do I mean? So on average you have 600, 700 children per school. That is on average more than 40 children per class. And because we don't have that many spaces, I mean buildings, school buildings, so schools are operating on 2 shifts. You know, the building is used in the morning for one group of children, 700 children, and then in the afternoon they are used for another 700 group of children, with different teachers, with different principals, school principal, etc., etc. But it's the same building. And what does that mean? It means that you cannot run ordinary teaching hours for children. It's not like between like 8 and 3, you know, long, decent, nice day of education, 5 days a week. No. The first shift is between 7 a.m., sometimes 15 to 7, until 11:30 a.m. The second shift is between noon and about 4:30 p.m. Okay, so usually a family of 5 children will have 2 groups. Maybe 2 or 3 will go to the morning shift, maybe another 2 or 3 will go to the afternoon shift. So for parents, what they should do, they should wake up in the very morning, 6 at the latest. Why? You have to wake up the children who need to go to the morning shift, prepare them some good breakfast, prepare their clothes, they are well dressed, everything is fine, and then they can go to the school. Fine, that's the first work. Let's forget about the life of the parents. Let's just talk about their duties toward the children. In few hours, like at around 11, the second shift should be already prepared to go to school. Few minutes later, like 30 minutes later, the first shift is coming back from school. So what they should do to the first shift, again, help them with the clothing, give them some lunch, ask them about homework, how they performed at school, etc., etc., and maybe give them a hand with the homework, like all mothers and fathers, you know, who try to make education easier. Now, because of the shorter teaching hours, we'll find the children, you know, some of the information is not well digested, the homework is maybe big, so all the time parents have to give the children help at home. Our teaching hours do not stop for children when they go out of school. No, it continues further, you know. A few hours later, the afternoon shift is coming back, and it's again the same story. So between 6 a.m. and 6 p.m., it looks like at least a full-time job for one of the parents, okay? Not to have in mind, not to speak about the life of the parents, because they should have their own breakfast, they should have their own lunch, and if one of them work, he or she should continue to think of work. If both of them work, then it's a totally different story. And then what brought this is the power supply. Poverty. While in Gaza, if you speak about half of the population under poverty rate, then we speak about half of the children living under families that live under poverty rate. How many children we have in Gaza? How many people we have in Gaza? Now they speak about 2.3 million people. How many children? More than a million, because 48% of the population in Gaza Strip are children. How many children go to schools? About 500 something thousands. More than half of them, well, about 280 go to normal schools, about another 270 go to governmental public schools. Okay. What does that mean? It means that you will have only one set of uniform for the school. As simple as it is, most of them, okay, they wouldn't really have two sets of uniform. So what if it's muddy, if it's rainy? It's not muddy and rainy like in the UK, obviously. We all know that, nothing is like the UK. But you will still have some days when it rains and the children will come back with dirty uniforms. So what you should do when the child comes with a dirty uniform, you need to give the child the second uniform, or you just need to clean it, to wash it and then iron it and then fix it for the second day. And then the question comes back to the golden hour. It's okay, now it's 7 p.m. The child needs his clothes to be washed and prepared. The question is power on or is power not there? Should we wait until 10 or should we make use of the coming 3 hours, And if we don't have power supply at the moment and the mother is tired, what should she do? Well, that's a question, Okay, hand wash, do everything by hand, and then what about ironing, So this is part of the daily life of the parents. And one would think, how would the mothers and fathers find some moments of joy in their life when this is how their daily life look like, The only day that children don't go to school is Friday. And Friday is a very important day for Palestinian families because it's the only day where all family members can have lunch together. Because all the other days, children are either, half of them are school or half of them coming back from school, So this happens to many different places in the world, They can't sit together like at 5 or 6 p.m. when the parents are coming back from work. But in Gaza, even if that is the case, it will be too late for some of the kids. Some of the kids will be just coming back from school. So that's how poverty and employment and power supply affects the lives of every person one way or the other. That's how our lives, daily life stories. And then internal political division, which is the other side of a long-term occupation. Occupation is something that is caused by an occupying power. I do not find and understand any reason for the Palestinian fragmentation that is affecting the population and affecting everything in a very negative manner. Now let's put all of that in one hand, and in the other hand, remember all the time that 70% of the population are refugees. 1.5 million people who live in Gaza Strip nowadays are Palestinian refugees. Being a refugee, you understand what is being a refugee. Now the international community understand more what is to be a refugee because we have seen many refugees coming from different parts of the world recently, which means that you don't have resources. You are not entitled to a piece of land, you are not entitled to have a flat, you are not entitled to have a job. These refugees are now like 50 and 60 years already in Gaza. Some of them, they have jobs. Some of them live good life, but most of them, they do not have such a privileged life, And that's why we have such a crowded place in Gaza Strip with more than 2 million people living in 365 square kilometers. Now, in addition to those challenges, it seems that this is not enough. What I have already spoken about is not enough. Because in addition to that, you have the attacks every now and then, the large scale military operation. Okay? Of course, we speak that within those attacks, we had also a year of COVID-19, And of course, we had the issues of the Great March of Return, when people were fed up with everything and they started to demonstrate. But also during those demonstrations, more than 5,000 people got really wounded with a bullet or shrapnel. The Ministry of Health, they say that more than 25,000 people were physically affected. A lot of them, they got like tear gas, etc., etc. But more than 5,000 got really the bullet or shrapnel one, physically wounded. A few hundreds got killed. But then the question is the psychological impact. Is it the psychological impact of the long-term deprivation, socio-economic problems, being a refugee? Is it the long-term impact of the short-term impact of the attacks on the population? Is it the impact of continuous violations of human rights, even depriving you from the right to protest and to say that I'm not living a decent life and I deserve to have a decent life? These are all questions. But the main question is that with each attack, there are all the time numbers. Numbers of the killed, numbers of the wounded, how many civilians were there. Most of the reports speak about 70% of the ones who get wounded or injured civilians. How many buildings were affected, etc., etc. And we hear numbers, yeah. And when we report, we also talk about numbers. And when we speak about the psychological well-being, people are interested in hearing numbers. But I think that is not fair for different reasons. But I'll mention only one now. Okay, this is it's not clearly shown, but I hope that you can see it. This is Gaza Strip. It's a small piece of land. This is the Mediterranean. This is Egypt. East is Israel, and to the north. Okay, and then the question. It's about 40 kilometers in length, 8 to 12 kilometers in width, and you see here plenty of green dots or green little squares or circles, and you see also some reddish ones, and you see some yellowish ones, and then you see some blue ones. Yeah. Well, this is a map that was made by one of the UN agencies after the May 2021 attacks. They continue to try to show where the attacks happened, and if you look at the blue colored circles or squares, these are simply facilities. Health and education facilities. Most of them belong to UNRWA. The green, all the other colors are affected or attacked areas. So the red ones are the mostly affected with the highest level of destruction. The greenish are with the least level of destruction. The yellowish are like between this and that. Well, let's forget about the level of destruction. Let's understand that destruction means bombing. Because the destruction happens because jet fighters drop some bombs on that area. And let's look again at the map and imagine if that goes for 11 days, what would be the lives of children and adults living in that area, having in mind that we don't have really shelters in Gaza Strip. We don't have shelters at all. And if you look, here it's the most density affected areas, and this is, unfortunately, you will find that it's the most areas with the blue squares, which means it's the highly populated areas. So this is Gaza City, northern Gaza, this is eastern Khan Yunis, this is Rafah, So this is the middle area, affected a little bit less than the other areas. And the question, how would you feel when you continue to hear the bombardment? Well, you cannot help at all, neither yourself, nor your family, nor your kids, nor your beloved ones. What would you feel as a father or as a mother? What would the children feel? How would they feel about life? And then, out of all this terror, we ask mental health professionals, what are the results? How would that impact you? And sometimes, you hear questions like, okay, let's try to divide it into the short term, the intermediate term, and the long term symptoms. Well, we can do that, of course, because we see that different responses, For example, we see that children during the attacks, they already have some abdominal, in the beginning, not abdominal, I mean some physical complaints. Pain in the abdomen, pain in the knees, adults, pain in the abdomen, pain in the back, low back pain, you know, sometimes in the ankles. Yeah. Sometimes children become more hyperactive during the attacks, during those days, because they cannot rest and they cannot show their fear, they cannot express it. So they just jump from place to place, you know. And you are simply, how to say, you cannot really help people overcome the difficulties. And then with time, you have sleep problems, sleep disturbances. Children start to show bedwetting, those we can say the intermediate ones. And then later on, PTSD, problems with education, yeah, low school achievement, and maybe becoming more peer relationship problems, more violence, etc., etc. So we have answers to many of the questions, and even we can give numbers, because numbers can be easily calculated, can be easily researched, and you can have the results, you know. WHO said in 2021, after those attacks, that we expect 210,000 people to have moderate to severe psychological mental disorders. Why? Because they have done a lot of research and they found out that under areas of conflict, about 10% of the population will develop these disorders. But is it similar to what happens in Gaza? 50, 60 years of being refugee, 2/3 of the population, 15 years of a blockade, exposure to 6 consecutive attacks in less than 15 years? I'm not sure about that. TDH, they said in one of the findings that it's important to provide mental health services to children, youth, families, teachers, frontline workers, enhance referrals to specialized mental health services. That's everyone, basically everyone. UNICEF, I'll come back a little bit to this later. World Child Holland said that we expect 670,000 children. That's 2/3 of the children in Gaza. UNICEF expected in 2014 that 370,000 children will be in need for help. World Child, like 7 years later, doubled the expectations, you know. And in GCMHP, we looked even at university students. And the results showed that students in Gaza, because of the conditions, they are having more distress, and it appears in the forms of anxiety, depression, acute stress, and that's the blockade compromised resilience, compromised social support, and increased psychological distress. But back to Save the Children report, because it's a recent one. It was issued in July 2022, and this is a work that they did in March and April, I think, 2022, about 7 months after the May 2021 attacks. And look at the results. 90% of the children feel less safe when they are away from their parents. Those children are not like 5 or 4. Those children who were interviewed or talked to were like 11, 12, 13, 14. 11, 13-year-old children, you know what they are. They do. They usually try to show their independence. Yeah, they want to go out without telling their parents. They want to come back whenever they want. They want to feel that they are becoming adults. You know, when in Gaza they are afraid when they are away from their parents, and this is compared to 60% in 2018. And the other issue is emotional distress. 80%, which is 8 out of 10 children, they are emotionally distressed, compared to 55% in 2018. What about parents? Because all the time there is a question about parents. The result, the idea of parents is a different one. Emotional distress, 96% reporting feeling unhappy and constantly anxious. And someone would ask, what about the other 4%? Are they not anxious? Everything is fine with them? Well, I hope so. 2/3 of the caregivers feel they are not useful, or they are unable to overcome difficulties. Yes, of course, because you need resources. If you don't have resources, if you don't have money, If you cannot have any kind of control over your life, then you end up really being useless. Yeah, we are entitled to do things because you have means to do those things, you know. And then we earn the respect of people around us because we are doing something. But if you cannot help even your children, how you are, you know, showing that you are a parent, that you are a father, or that you are a mother. Anyway, we summarize all of that in 2 words, you know, that people could feel hopeless or people could feel helpless. These are the 2 simple words. And this combination is a very dangerous and very serious one. Why? Because how you can help. The question is always, what can you do in order to help and do that? I know that I am running over time, but anyway, please be patient with me. It's very difficult, someone coming from Gaza telling people in the United Kingdom to be patient with him, isn't it? But anyway, that's the thing you have to deal with. This is a group of my colleagues, the staff that work for GCMHP, and these are mental health professionals, most of them. We run through multidisciplinary teams. We understand that the intervention should be a comprehensive one. We are not by any way dealing with medical condition. Of course, some of the people come with a medical condition, but it's far beyond that. You need to intervene in the society, you need to talk to the parents, you need to talk to the patient, you need to provide psychotherapy. Medication alone is not enough. You need to do a lot of things. Yeah. So, what can you do? Again, this is a demonstration. It's a combination of biology, psychology, and sociology. One of the basic things, and I'll not talk a lot about our intervention, I can tell you where you can find those news about GCMHP work, but of course what you do with the children. That's one of the big questions. What can you do to children, you know? We have 3 community centers, as I said, and we apply we try 3 interventions with the children. One is art therapy. The other is play therapy. The third is psychodrama. This picture is of a child who is in the play therapy room. The play therapy room is twice as this room, just to not to be mistaken by the picture. It's a place when it's packed with toys, and children are asked to pick whatever toy they want. This young child, this young girl, she went to kitchen, and sometimes children, when they, in this instance, play with the kitchen toys, they tell the stories, you know. It's not only the story of cooking, but perhaps the story of a woman or a mother who is suffering from domestic violence, or perhaps a story of a kid who is beaten up by her older brother, for example, or maybe a story of a kitchen that got hit by a missile that destroyed the kitchen. You never know what kind of story that child is going to bring up. And through play therapy, we show the parents, because we use the one-way mirror approach. And usually the father or the mother or both are watching from behind the mirror, you know. And they see how you need to help the child. Because you tell the parents, do you play with your children? And they say, all the time. Okay, sit behind the one-way mirror and see what we do with the children. So we sit on the ground, we start to play with the children, and they start talking. And then the parents say, well, that's not what we do. We do something else. What is it? Well, the kids, they play with the toys, and we are sitting next to them with the mobile phones or on the TV. Well, that's not playing with the children, okay? Let's try to address those children and deal with them in a different manner. And then when they start hearing the stories that the children bring, it's a totally different issue, you know. Then they understand what's really wrong. Because children bring issues that it was never in the minds of parents. Okay? Parents are all the time surprised by how the children can understand what happens around them. Yeah, and what they are afraid of, the stories that they have heard or seen, how they impact the children. So this is play therapy, art therapy, drawing to a little bit older children, because sometimes you cannot really bring 11, 12, 13 old children, ask them to play with toys. And the older children, they draw different things, you know. And usually they pick whatever comes to their mind, you know. And sometimes after attacks, they draw destroyed houses or killed people or bombs falling. And they bring the stories, actually. So the play therapy room is a very nice diagnostic and therapeutic mean to help the clinicians work with the children. And then the psychodrama, it's a group of children who can sit together for five sessions, or can be in groups of 10 to 11, 12, sometimes maximum 15 children who can really join the therapy and try to get rid of the problems that they are affected with. Adults, it's a different story. Why? Because adults have different complaints. They are more expressive. You sit, you diagnose, okay? 40% of the people who came to our centers last year had depression. The highest diagnosis at GCMHP in the recent years. 25 to 30 anxiety and trauma-related disorders. And then about 1/4, 20 to 25%, the usual medical diagnoses that are like, you know, like biological issues like schizophrenia, for example, or psychosis. How to deal with them? Mainly psychotherapy, cognitive behavioral therapy, and related therapies, or medication. But with time, we find that there is more need for medication. It's not anymore enough, you know, because it's too hard. And the other issue, because it's getting harder to treat people because things are repeating themselves. The exposure to trauma is getting more and more. You are not exposed once, not twice, not 3 times. Now it's 6 times, yeah? And you see in the near future that things are not getting to be better, you know. So again, struggling with the feeling that people are hopeless or people are helpless. And then you all the time have problems with accessibility, you know. You have problems because of stigma. Stigma is everywhere, you know. But maybe more in the Middle East, in the Eastern societies, in the more traditional cultures, if you could say, but it's everywhere, you know. So what can you do with the stigma? What can you do with the accessibility issue? Which means if you live in a place like Beit Hayun or Beit Lahia, which is like here, this is our community center. This is like less than 10 kilometers, but the cost of the trip forward and backward is about 10 shekel per person, 8 to 10 shekel. So what if it's 2 people coming, 20 shekel? Well, it's enough to buy tomatoes for 1 week, for example, for the family. And not people can really afford it. So what can you do in order to make it easier for people to reach you and also to combat stigma? So this is the 3 community centers, but these darker circles are for community-based organizations, which are like smaller NGOs that are not really focused on mental health, not like us, but that they offer us a space. We rent from them 1 room and we send our psychologist, 1 or 2 psychologists, depending on the space needed, on the number of people who come. And we just say, we are here, please come and see us. So in addition to those 3 places, we have in the eastern areas of Gaza Strip, East Khan Yunis, East Middle Area, Eastern Gaza, and the very north and the very south. So it's less shameful. They are going to a recreational center or they are going to a cultural center. Everyone goes there. No one talks about mental health, but then you find the therapist there sitting. Okay, so we try to work with people in their localities as much as we can. And then we have our toll-free line that people can call free of charge. And that toll-free line, we make sure that it continues to work even in times of attacks and military operations, because it's almost the only thing that is doable during the attacks, because moving around is, you know, it's pretty not possible. Okay, we have many other things that we do. One important thing is that you need to all the time not talk to parents, but also talk to the whole community. Because how many children we saw last year? We have reached 5,000 children, but children who came to our therapy are 1,500. The remaining 3,500 were like benefiting from other interventions. I'll show you one of them. Okay, like we work with schools, we work with kindergartens, we work with sport clubs, etc., etc. But you need to talk to the whole community, because we sit with the child once per week, but we sit with 5,000 children per year, but there are 1 million children. So we need to train the parents. How we do that? TV programs, radio programs. You use also Facebook. If you look into our Facebook page, or how is it called, page anyway, site, or you will find every now and then, like once weekly, a new video clip for about 5 to 10 minutes telling mothers and fathers what they should do. And then we have a very nice educational capacity building program. We try to teach and train people who are working in the field how they can simply identify cases, how they can provide basic counseling, and where and how to refer cases if there is someone who is in need for a lot of support. And the question remains all the time how we can find hope. You help people recover one way or the other, but how can you help children, for example? And that is all the time something that we have in our mind. And here I'll show you the next video, which is just showing you how some of our interventions are really bringing hope. And that this is something that we can show, because other things, you feel them, you see them, people improve, you feel that you have achieved something, the team member is very happy, they are reporting how successful they were, but we cannot go and film patients in our community centers. But this is something, hopefully, that will give you a good picture of sometimes what we do.
كان الاشي غريب علينا وكانوا الاهل مش موافقين، فمع مرور الوقت تعلمنا شوية مهارات فاخذنا على الوضع. في المدرسة احنا ما كانوش يعطونا رياضة، فاحنا لما اجينا هنا وتعودنا على الرياضة هذه صرنا نستنى في الجلسات السنة عشان يجن ونلعب، وتعرفنا على صحبات جداد. لما جينا هنا تعلمنا مهارات حياتية مثل الاتصال والتواصل والضغوطات والثقة بالنفس، وأيضاً تعلمنا مهارات رياضية مثل كرة الطائرة. تعلمنا كثير مهارات زي المهارات الحياتية مثل ضغوطات الحياة واتخاذ قرار والعمل الجماعي، وزي المهارات الرياضية مثل كرة الطائرة زي الاستقبال والإرسال من أسفل وأعلى. المجتمع بشجعش البنات انهن يروحن على النادي ويلعبن فيه.
قبل ما اجي على المشروع كنت العب في الشارع، وكانوا الناس يطردوني، وكنت اخاف ان مثلا انجرح من الاذى في الطريق. وبعد ما جيت على المشروع صرت الاقي مكان العب فيه، ومثلا اصدقاء، وانه ارتاح من الضغوطات البيتيه ومن الضغوطات المدرسيه.
أنا مبسوط كتير وبتمنى المشروع يستمر.
تعلمنا مهارات حياتية كالعمل كفريق، وتعلمنا مهارات رياضية نسدد على الجول ونسدد. أنا مبسوط وبتمنى إنه يضلوا معنا مستمر، لأنه طلعنا من ضغوطات المدرسة وضغوطات البيت.
Thank you very much. That's what I wanted to say.